Hello. I'm going to present to you how we are using DHIS2 Android-based data management system in low settings. So the program that we are using this software, which is called DHIS2 for, is called Ready Plus. And our geographical focus is Zimbabwe, Mozambique, Eswatini, and Tanzania. This program is focusing on young people who are between the adolescents and young people who are between the ages of 10 and 24 years and living with HIV. And it is a consortium which is led by Frontline AIDS with 6 regional or national organizations, and of course 14 community organizations who are implementing at community level. And the goal is to have young people who are resilient, empowered, and knowledgeable, and have the freedom to make healthier choices and access services and commodities. DHIS2, which stands for District Health Information Systems version 2, is the largest information system, and it is used in 73 countries, and 2.4 billion people represent or are found in the 73 countries in which this software is being used. This is a free and open software. It tracks individuals or individual level data longitudinally, and therefore Ready Plus customized DHIS2 software and called it Wanda. So why did we choose DHIS2? There are a number of reasons why we chose the DHIS2, and one of the reasons is that we are collecting data at different levels, and we're also collecting data which also applies to a variety of services. So, for example, we've got HIV care and SRHR and PSS data which we collect at health facilities. We also do have advocacy data, and these different pieces of data require different ways to collect and analyze them. So, therefore, we chose DHIS2 mainly because it is able to track patient level data. It is scalable across different countries. It is also able to support multiple languages, and it can allow data to be entered from anywhere. So in terms of the actual Wanda system, we have got what we call the service tracker, and this service tracker collects all the service data that we are tracking for the young people, and we also do collect data on our client satisfaction with services. We also collect data on group safe spaces that are conducted. And for all our data, as you can see, it is de-identified. Therefore, we make use of a unique identifier code. So why do we measure client satisfaction? This is mainly to be able to improve user experience of the software. And how we have measured this in this particular instance or context was to use a non-experimental design where we were asking the client or the CATS, which stands for Community Adolescent Treatment Supporters, who are also peer counselors, how they felt about the system. And the results on overall show that the system quality is 3.98 out of a total of 5, which is quite significant, showing that on overall the adolescents and young people felt that the system is easy to use and actually allows them to conduct their day-to-day work in the communities. What we have learned is that the software does facilitate bidirectional linkages. It also allows scaling up across different geographical locations, and also across different countries where they use different languages. There's also a dual function of data data recording, and also of communicating with the actual clients or the actual people that are receiving services within the communities. There's also shared ownership, which also increases responsibility as well as accountability. And of course, it allows us to check service uptake. And how do we move forward from here? We have realized that designing and rolling out a DHIS2 Android platform is quite challenging, but in the end, it is rewarding. Because there are also options of integration and interoperability of Wanda with other softwares. This will also enhance the user experience. And also, in order for us to improve buy-in, we are looking at identifying champions, at the different levels. So at country level, at subnational level, at provincial level, district level, and also at implementing organization level, so that we are able to facilitate the acceptance process. Thank you very much.